Canadian health insurance process. How it works. Canada is renowned for its universal healthcare system, which provides medical coverage to all Canadian citizens and permanent residents. The system is publicly funded and administered on a provincial or territorial basis. The Canadian healthcare system is designed to ensure that all residents have access to necessary healthcare services without financial barriers. Here's an overview of the Canadian health insurance process and how it works. 1. The Canadian health insurance system. A brief overview. Canada's health insurance system is largely publicly funded through taxation. The system is often referred to as Medicare, though it is not a single nationwide program. Instead, the health insurance program is administered by each of the 13 provinces and territories in Canada, and each jurisdiction has its own healthcare plan. While healthcare is publicly funded, provinces have the flexibility to administer their own programs within certain guidelines set by the federal government. This ensures that healthcare is publicly available to all residents, regardless of income or employment status. 2. The role of the provincial and territorial governments. Each province or territory in Canada manages its own health insurance program, determining the specifics of coverage, benefits, and eligibility. However, all provincial health plans must adhere to the Canada Health Act, which ensures that they meet certain criteria. Public administration. Health insurance plans must be publicly administered by a nonprofit organization. Comprehensiveness. The plans must cover all medically necessary hospital and physician services. Universality. All residents of the province must be covered equally. Portability. Coverage must be available to residents even if they move to another province or territory. Accessibility. Healthcare services must be provided in a way that does not create financial or other barriers. 3. How the registration process works. To be eligible for the provincial or territorial health insurance plan, individuals must be residents of Canada and meet the residency requirements set by their specific province or territory. Permanent residents and citizens. Canadian citizens and permanent residents are eligible for provincial health insurance. Newcomers to Canada. Immigrants and refugees who have arrived in Canada may need to wait for a few months before they are eligible for coverage in certain provinces. Work or study permits. Some temporary residents may be eligible for health coverage depending on their province and circumstances. Once eligibility is established, individuals must apply for a provincial health card, also known as a health insurance card. The application process typically involves filling out forms and providing proof of identity and residency. After the application is approved, the individual receives a health card, which grants access to healthcare services. 4. Coverage under provincial plans. Each province's health insurance plan provides coverage for medically necessary services, including hospital services, inpatient care, surgeries, and emergency room visits. Physician services, visits to family doctors and specialists. Diagnostic services, tests like blood work, X-rays, and imaging. Surgical services, procedures performed in a hospital setting. However, coverage may not include certain services such as prescription drugs. While some provinces offer partial or full coverage for prescription medications, this is not universally provided through the public system. Dental services. Dental care is often not covered by public health insurance, though some provinces provide limited coverage for children and low-income adults. Vision care. Eye exams and glasses may not be covered unless there's a medical necessity. Alternative treatments. Services like chiropractic care, physiotherapy, and massage therapy may require private insurance or out-of-pocket payments. 5. Additional coverage options, private insurance. While Canada's public health insurance system covers the basics, many Canadians choose to purchase additional private health insurance to cover services that aren't included in the provincial plans. Private insurance often covers prescription medications, dental care, vision care, chiropractic and physiotherapy treatments, medical supplies e.g., hearing aids, ambulance services. Employers in Canada frequently offer private health insurance as part of their benefits packages. Individuals can also purchase private insurance independently. 6. The cost of healthcare and funding. Canada's healthcare system is funded primarily through taxes, including income taxes, payroll taxes, and other levies. The federal government provides financial support to provinces through the Canada Health Transfer, which is a contribution toward healthcare funding based on population size and other factors. The amount that an individual pays for healthcare services is generally limited. For example, Canadians do not pay directly for most physician visits or hospital stays, but some provinces have small user fees for certain services or may charge a nominal fee for things like ambulance services. 7. Portability and out-of-province coverage. One key feature of Canada's healthcare system is portability. If a Canadian moves to another province or territory, they are still entitled to healthcare services under the new province's health plan. However, there may be a waiting period of up to 3 months before new residents are covered, depending on the province. For Canadians traveling outside the country, provincial health insurance does not cover medical expenses. For this reason, many people opt to purchase travel health insurance to cover any potential healthcare costs incurred while abroad. 8. Waiting times for services. One challenge in the Canadian healthcare system is the issue of wait times for certain non-emergency services. Canadians may experience longer waiting times for elective surgeries, specialist consultations, and other procedures due to the demand on the healthcare system. While urgent and emergency care is prioritized, individuals seeking non-urgent treatments may face delays, especially in more densely populated areas. 9. Health insurance for foreign visitors. Visitors to Canada, such as tourists, students, or temporary workers, are not covered by provincial health insurance. Therefore, they must obtain travel health insurance to ensure they are covered for any unexpected medical expenses. Provincial health insurance only covers individuals who are residents of Canada, so visitors should be aware of this and plan accordingly. Conclusion: Canada's healthcare system is designed to provide equitable access to necessary medical services for all residents, ensuring that no one is excluded based on their ability to pay. While each province manages its own health insurance plan, the system is rooted in the principles of universality, accessibility, and comprehensiveness. Despite challenges such as wait times and limited coverage for certain services, Canada's healthcare system remains a model for many countries around the world.